The PPE required for the periodontal probe is a face shield, a mask, a KN95, glasses, gown, and gloves. For our armamentarium, we are required to have our Marquise probe, our dental mirror, floss, neighbor's probe if needed, patient glasses, patient bib, bibsy, saliva ejector, HVE, 2 pieces of gauze, a cotton tip applicator, air water syringe tip, as well as a tray with liner and cabicide. This is my Marquise periodontal probe. It is an assessment tool that is used subgingivally. It is a double-ended, unpaired instrument and has a flexible, simple shank that is circular in cross-section. It has a blunt and rod-shaped tip with no cutting edges. It is calibrated in millimeter markings like a mini ruler, with a walking stroke of 1 millimeter increments. You will document the deepest depth per zone. It is used to determine the health of the periodontium. Measures the sulcus and pocket depths. It measures CAL, width of attachment, assesses for bleeding, used to measure intraoral and extraoral lesions, recession, and longitudinal response of the periodontal treatment. We should always inquire any past or present history of any periodontal treatment or gum disease, and if they've had any concerns with their gum tissue. In this next clip, I will perform the tension test. Here we tug on the upper and lower lip, assessing and determining if there's any abnormal muscle pulling on the gingiva and or if there is a short front. When we begin to probe, it is super important to gently insert your probe tip beneath the gingival margin to the base of the sulcus or the pocket. We want to maintain the probe beneath the gingival margin with each 1 millimeter walking steps. Wrist or digital activation may be used, making sure to keep the tip in contact with the root surface. We also want to make sure we stay in our modified pen grasp at all times. Now we'll begin to assess tooth number 3. We'll now move on to tooth number 6. The last tooth we will be assessing is tooth number 20. Here we will do the mobility test. This test is to simply check for movement by slightly rocking the tooth back and forth with our mouth mirror and pliers. We do this to check the degree of movement. The mobility of the tooth is then broken down into 4 categories: N being normal, 1 being slightly mobile, 2 being moderately mobile, and 3 being severely mobile. The next test we do is to check the open contacts. This is where we evaluate the open contacts of the teeth or any areas of food impaction with dental floss. In this part, I will talk about recession and determining CAL. Recession is when the gum tissue starts to wear away. When it comes to determining CAL, we will take the probing depth plus the gingival margin level to figure out what the clinical attachment level would be. For the recession on this tooth, I would say the probing depth would measure a 3 and the gingival margin level would measure a 3 as well, making the clinical attachment loss be 6 millimeters.